So on report, I've received that the patient is a 26-year-old female admitted on September 18th, 2018 for anxiety. She came into the ED with tachycardia, hyperventilation, fatigue, restlessness, diaphoresis, lack of concentration, with racing thoughts and irritability. Patient ran out of medication at home and stated she could not afford it. She came in 2 weeks ago for an anxiety attack as well. She was given Ativan in the ED and has been on a set schedule of Prozac per MD order since last night. She is currently calm and just woke up. She's also full code.
Now that the nurse has given a report, she will not wash her hands and introduce herself to the patient. She will inform the patient of the physical assessment and explain thoroughly.
Come in. Hi, my name is Nita. I'm your student nurse for today.
Hello.
I'm here to do your physical assessment. I'm going to wash my hands and I'll be right over there.
Okay.
Pull the curtains for privacy.
Thank you.
Before we start, can you tell me your name and date of birth?
My name is Concetta Katz, 11/18/1991.
All right, correct. And if you can tell me where you are.
I am at the Jamestown campus.
Do you know the day? The date?
September 19th, 2018.
And do you know why you're here?
Yes, I had another anxiety attack.
And do you have any allergies that you want me to know of?
I don't have any.
Okay. And on a scale of 0 to 10, 0 being no pain and 10 being the worst, what would you rate your pain?
0.
Okay, and now I'm gonna go ahead and take your vitals. Is that okay? All right, I'm going to start your blood pressure. And your blood pressure is 116/60.
Okay.
I'm gonna check your pulse. Pulse is 70, and your respirations were 12. And temperature. Your temperature was 98. Alright, and now I'm gonna start my physical assessment. Is that okay?
Okay.
Alright, I'm gonna start with the head. I'm gonna look for symmetry. Your eyes are symmetrical, nose is in line. Your ears are symmetrical, everything looks even. Your skin is normal. I'm gonna feel in your scalp, is that okay?
Mhm.
And let me know if you feel any tenderness, any kind of pain or anything. I'm gonna be looking for any lacerations, cuts, bruises, that sort. Anything? Do you feel anything? Alright, I'm gonna also check to make sure you don't have any like scabies, any marks on the back of the neck. It looks normal. Okay, and now I'm gonna look at your eyes. I'm gonna do a vision test and shine a light and have you follow a pen light with your eyes.
Okay.
With the vision assessment, the nurse will be assessing cranial nerves 2, 3, 4, 6, and 7, the optic nerve, oculomotor nerve, trochlear nerve, abducens nerve, and the facial nerve. These all assess extraocular movement and visual acuity fields.
First, I'm going to assess for Perla. If you can focus your eyes on the chart, and I'm going to shine a light. I'm going to do the same to the other side. Her pupils were round and reactive to light. And now I'm going to, if you can follow the pen light with your eyes. And now, if you can follow the pen light, it's a test for ocular movement. All right. I'm also going to look at your conjunctiva of your eyes, and they're pink and moist. I'm also going to check your ears. Is the next. So do you wear any hearing aids?
No, I don't.
Okay. Have you had any surgeries, anything like that?
No.
Okay.
Not in my ears.
I'm going to shine a light in your ear to just make sure they're. You can turn this way. Okay.
Now the nurse will assess cranial nerve 8, which is acoustic. This cranial nerve assesses hearing.
You can tell me if you can hear it, okay? Okay. And now I'm going to look into your nose. First I'm going to assess your nostrils. They look symmetrical. I'm going to shine a light in. Now hold. Okay.
With the assessment of the nose, the nurse will assess cranial nerve 1, olfactory, which is the patient's ability to smell.
So have you had any broken noses, any surgeries?
No.
Do you have any discharge?
Mm-mm.
Do you have any trouble smelling anything? Okay. If you can close your eyes. And I'm going to test your smell. Can you tell me what you smell?
Ooh, alcohol.
Okay. Next, I'm going to check the inside of your mouth. Before we start, do you wear any dentures? Any, all of them are your teeth? Okay. Any sores? Any bleeding
No.
that you noticed? No. Okay. You can say off for me. Okay. Her mucous membranes are pink and moist. Can you lift your tongue up? All right.
With the assessment of the mouth, the nurse will assess cranial nerve 5 and 9, the trigeminal and glossopharyngeal, which assess for facial motor function, cranial nerve 5, and taste and swallowing, cranial nerve 9.
If you can clench your jaw for me. Do you feel any pain, any discomfort? All right. And if you can open your mouth and say ah. All right.
The nurse will now assess cranial nerve 7, 10, 11, and 12, the facial, vagus, accessory, and hypoglossal cranial nerves. These assess for swallowing abilities, checking accessory muscle function, and assessing motor supply to the tongue muscle.
If you could raise your eyebrows for me. All right. If you could swallow and speak.
Hello?
Did you have any difficulties?
No.
Can you also shrug your shoulders? Any difficulties?
No.
And if you could stick out your tongue for me. All right. Next, I'm going to assess your swallowing. You can swallow. Okay, now I'm going to assess for your JVD. If you can lift your neck, and turn your head to the right. All right. And I'm going, if you can come back. And now I'm going to look for the midline of your trachea. And just tilt your head up. All right. Until it's normal. Next, I'm going to feel for lymph nodes. Okay. Now I'm going to do your carotid pulses. They're strong. And now I'm going to do an assessment on your chest. I'm going to listen to your heart sounds and your lung sounds.
Okay.
So I'm going to start with your heart sounds. So we're going to listen to your aortic, pulmonic, Erb's point, tricuspid, and mitral.
Okay.
Now when I listen to your apical pulse, if you could just lift your breast up for me.
Okay.
And I will listen here for a full minute. Now I'm going to listen to your breath sounds. Each time I move my stethoscope, if you can just inhale for me. Inhale and exhale for me.
Okay.
So I'm going to measure from the clavicle to the second. Your breath sounds on the front were clear bilaterally, or clear. Now I'm going to listen to your breath sound on the back. There are 8 on the back. I need you to move your hair.
It is pertinent that the nurse ask male or female patients if they practice monthly self-breast exams. If they do, you can use something similar to the teach-back method to have the patient tell you what they know about it, and you can correct them on anything that may be wrong or always add to what they have already told you to allow for the patient to be able to properly examine their breast every month. You will also want to include the best time to do this is 2 to 3 days after their menstrual cycle has ended and right before you get into the shower. This includes starting at the tail of Spence in the axillary region and going inwards towards the areola. You can take your first 2 fingers and go circularly around the areola, or you may also go linearly. This is checking for any bumps, any abnormal findings that the patient may have.
Next, I'm going to assess your bowel sounds. Can you tell me when was your last bowel movement?
This morning?
And when you last urinated?
This morning.
Was there any difficulty?
Mm-mm.
And with your bowel movement, any abnormal, how was the texture?
It was normal. It was brown in form.
All right, and any out of the ordinary bad odors? Okay. And are you currently sexually active?
Yes.
Are you on birth control?
No.
And when was your last menstrual cycle?
Last month.
Okay. And I'm going to listen to your bowel sounds.
Okay.
All right. If you can lay down for me. While I assess for her bowel sounds, I'm going to also look at her stomach to make sure that the skin is intact and normal. I'm going to listen to each quadrant for 2 minutes, or until I hear a sound. Okay, everything sounds normal. Now I'm going to palpate your stomach. Tell me if you feel any tenderness, any pain in each quadrant. And before I did this, I also noted that there wasn't any distension or anything. All right. Next, I'm going to sit you back up so we can assess your extremities. So I'm going to start by your arms.
Okay.
Your skin looks normal, intact. All right. I'm going to check your pulses. So I'm going to start with your pulses. And then your radial. I'm going to check for cap refill. Fingers, and they are less than 3 seconds. If you could lift your arms for me and put them back down. Did you have any difficulty, any pain or anything?
No.
All right. Can you also put your arms out to the side for me? All right, and back. Your skin is warm to the touch, and I'm gonna look for skin tenting. Trigger's good. And now we're gonna move to the lower extremities.
Okay.
So first, I'm gonna assess the skin. Everything is normal. No cuts, no bruises, nothing like that. The skin is also warm to touch. So I'm gonna start with your femoral pulses, if that's okay. It's right here in the groin area that I'm gonna feel for, both bilaterally. Okay. I'm also gonna feel for your popliteal pulses, it's right behind the knees.
Okay.
Okay. I'm gonna feel for your pedal pulse. So, right there. And tibialis posterior. Posterior tibialis. And if you could push back with your feet and push forward. Can you, do you have any difficulties walking or anything? And they're less than 3 seconds. Now, if you can get up and walk for me, this allows me to assess your gait to make sure that you're walking normally.
Okay.
So you can walk to the door and back, and I will tie your gown in the back.
Okay. Thank you.
You can walk to the door and back for me. Do you notice any difficulties walking? All right, you can sit back.
Thank you.
You're welcome. And now I'm going to check your backside to make sure that there aren't any skin break. There isn't any skin breakdown. Is that okay?
Okay.
All right. I'm going to put the guardrail up. And go ahead and that. Okay. Roll over. And your backside looks normal. Intact, skin is intact. I don't see any breakdown. All right, and your bottom looks normal as well. Okay. And I also need to check your IV.
Okay.
You have a 20 gauge antecubital right arm, and it is clean, dry, and intact with a clear dressing.
Okay.
All right. Well, that's the end of my physical assessment. Is there anything I can get you before I go?
No, thank you.
All right. I'm gonna leave you with your call bell.
Okay, thank you.
And just call me if you need anything, okay?
Okay.